if you want to age gracefully, you need to have a growth mindset. So how did this affect me? I know is one of the questions you're going to ask. And it made me a better trainer, because if I have a neck injury or a spine injury, here's the entire backup plan for that. Wrist injury, and lots of women get wrist arthritis, and I have a limited range of motion in this. Here's the backup plan. Here's how we work around. There's always a workaround, and your body needs to find movement. And yes, there were many times I've come home from the doctor and I've cried because I can't do this exercise anymore and I can't do that exercise anymore. Well, there's a lot of other exercises out there, and I will find something else that I can do.
Well, it's a real pleasure to have on the show today, Jill Brown. Welcome.
Hi, Zora.
It's really fun to have you here to discuss a topic that I am really getting into this last year. And it's all about joint issues and surgeries and the woman who's going through the menopause transition and women who are pretty active. And you are like me, you've always had an active life and you're fit and you practice what you preach, but you, like me, have had to deal with surgeries. And I believe you had a spinal surgery and a hip surgery and there was a wrist surgery, right?
Wrist surgery, yeah, from an accident.
Yeah, it's crazy. So maybe give us a rundown on what came first and then why you think you had this injury. What do you think what the root cause was maybe?
Well, there was a time when I was overweight, so I wouldn't say that I was active all the time. There was a time in my late teens and early 20s where I put on an excessive amount of weight. And I worked really hard to get it off, and that's when I realized I was addicted to exercise. That was life-changing. It was right after college. And cut to me becoming a fitness professional. I took a few different circuitous routes, and when I became a fitness professional, I started having orthopedic problems. And I tore a tendon in my early 20s, and the doctor looked at my biomechanics. He was a well-known doctor. He did some of the sports teams, and he looked at my biomechanics. And he says, "Are you sure you want to do this for a living?" Because I was transitioning. I used to work in TV, film production, radio, media. And I said, "Why do you ask?" And he says, "You're going to have a lot of problems." And he told me that when I was about 26 years old. Wow. And so every time an injury happens, I'm like, yeah, Dr. Keith told me I was going to have problems. And why do some people have more injuries than others? And biomechanically, if you look at somebody who is 90 years old and they're still running marathons, they've been running marathons their whole lives and they never get injured, they have a certain lineup. There is a pattern to how their joints are lined up, how their shoulder connects to their elbow, particularly the depth of their hip socket, how their femur bone sits in the socket, how it relates to the knee, how the patella is situated, which goes down to the ankle, and it's all connected. And people who just happen to have this genetic lottery, they won that golden Willy Wonka ticket, and they just were lined up perfectly. They will run, they will do sports unless they have an accident. You can trip and fall or whatever, but they will not have problems like other people will. And when we have things that are a little bit off kilter, like some people, I have a slight curve at my spine, my sister's is worse. I was born with shallow hip sockets, which is why I had to have my hip replaced. If you're born with shallow hip sockets, you get what your German Shepherd had called hip dysplasia. And that's a symptom of shallow hip sockets. And it just means that the bones rub together more because the socket is shallow, and you get arthritis sooner because the cartilage wears away. That can also happen in your shoulders. People can dislocate their shoulders more than other people. And so, if you really care, when you're fully grown at like 20 years old, you can go to a doctor or a physical therapist, and you can have somebody like check all your alignment and help you from that age forward protect yourself by balancing out your muscle. So a lot of women, their quadriceps, the front of their leg is stronger than the back of their leg, so they wind up having knee pain. And then their hips are wide, but their shoulders are narrow. So their femur bones, these bones right here, are kind of angled in, and then they don't translate to the knee that well, and then they wind up having hip problems, knee problems, back problems. So a lot of it is just the lottery ticket of how your bones were lined up. For me, I had the shallow hip sockets, I had bad posture as a kid, and that progressed the problem that I had in my spine. So I had a neck surgery when I was 35.
Wow, that's so
after
early.
a car accident.
Oh, that
so
was a
young.
car accident.
I
Okay.
had a car accident when I was 35, but the doctor said, this problem is not from the car accident. You have had this for years. It's been developing over time. I said, why? He said, you have a narrow spinal column. So if you have a skinny spinal column, you're going to be more prone to having bulging discs because there's not as much space in there. So if your spinal column is like this, you have a little accident, you have I did a lot of crazy activities. I was rock climbing and mountain bike riding and boxing and things where impact activities. And so a disc gets pushed, and then the next thing you know, it gets pushed into the into the spinal cord. So that happened to my neck, and he said, oh, at 35, he said to me, this is going to happen in your lower back too, because it's genetic. And
Did
so sure enough,
it?
23 years later, there I was. Now, could this have been prevented? Like I said, yes, if you're really proactive about it, like you're going to be working out a lot, like you're a dancer maybe, or you pick one particular sport so you know you're going to overuse certain muscles. I mean, I don't know anyone who's done this except for like professional athletes. You could talk to some orthopedic doctors or people who are alignment specialists, not a chiropractor, alignment specialists, like very high level Pilates instructors or people that can assess all of your structural alignment. They even have these type of cameras that can see where all your joints are. You can go to a sports performance lab and they can literally, so you wanted to talk to a biomechanics specialist and they can see, oh, your right knee moves in a little bit when you're running. And over years and years of your right knee doing this, like you're running, but your right knee does this, over years and years and years, you're going to develop a problem with your knee. But somebody whose knee is perfectly straight will be running till they're 100.
So interesting. So then
Yeah,
genetics does play a role. I've
huge.
heard injuries also plays a role, these joint problems, and then eventually surgery. And then you have other risk factors like being athletic. And those are the three that you mentioned. Being obese is another one. And then having, which is not your case or my case, but then you have the fact that you are aging. So there's the time factor, being female as well for certain injuries or certain issues. I'm not sure about the back, but I know for hips for sure. And then the hip dysplasia you mentioned, which I never heard that I had, but evidently the doctor recently told me I had. But there's a lot of things that come into play because a lot of people may look at you and they accidentally to me like, you getting a hip surgery? They're like, how? Like, why? Like that just
I
doesn't.
get asked that all the time on TikTok. Well, what did you do wrong that you had a spine surgery? What did you do wrong that you needed hip surgery? Well, if I had been less active than I have been, if I had not become a fitness professional, I would have needed it anyway, but probably at 70 instead of 50 something. Mm-hmm. So we can exacerbate it by a lot of activity. The one tip that I really have is to prevent it. If you do more type of cross training, if you do things like Pilates, so I'm a huge Pilates person now the last few years since my hip surgery. The more things that you can do to balance out your body and to not overuse one area. So people who run, if you do, or cycle, you do a very repetitive pattern. Even if you swim, a very repetitive pattern, and it's always the same muscles over and over again. And then the ancillary muscles don't work as much. So I believe that, and I started practicing this at 40, is that the more we do full body workouts, I switched my workouts from being more like cardio, lifting. So they call that splits, like all cardio and then all lifting days. And I started to blend them together into more cross training, and that tended to put off the injuries for my need for surgery a little bit longer. So more full body, balancing things out. Whereas a lot of women, we're not small, skinnier, or smaller men, right? Like we treat our bodies, and so the programs that women tend to do for strength training are the same ones that the male bodybuilders do. And there is still the old split days where today I'm going to train back and triceps, and tomorrow I'm going to do shoulders and legs, and Thursday I'm going to do, and these are called split days where you pick two body parts, you go to the gym and you train those. Those are all well and good, but that is for just growing one muscle at a time. I call those mirror muscles. I'm going to grow my bicep, I'm going to grow my tricep. And you're working one muscle at a time instead of working your body synergistically, because it's all connected. If you've ever had an injury and you've had a good physical therapist and you went to physical therapy like you should have, always go to physical therapy after an injury. I promise you it is worth your time. Better than going to a chiropractor. I can answer that question if you want to know why, but always go to a physical therapist, and they will say, their mantra is it's all connected. And so the more you can balance out your body, the more you do full body workouts, I think the better. If you do two front of your leg, do two back of your leg exercises. If you do one outer thigh, then do one inner thigh. If you do your shoulders, then also do a bicep and a tricep. So don't just overdo one. Now you can do a full body workout and then say, but I want to focus on my shoulders a little more. I'll do that. I'll do a full body, like a Pilates type workout, and they'll be like, and today I want to do some extra shoulders. And tomorrow I want to do some extra butt. And then Wednesday I want to do extra abs. And so you can then pick and add on. But I think for women as we get older, and this is what I started to do, it changed my body after 40. I got into the best shape of my life at 40, and then I said, can I do this again at 50? And then I did it again at 50. And I just think the full body workouts, most of your workouts should be full body, and then pick something, a mirror muscle you want to focus a little bit more on to keep the body more balanced.
How old are you now?
57, I'll be 58 in March, in the spring.
Okay, so you're going to smash it when you reach 60, and then
we'll see.
Another challenge.
I have a lot more injuries now, and some of them, like I said, are genetic, but the wrist was a slip and fall. And one thing that does happen is if you do have one injury, because maybe it was an accident or maybe you just overused it, like you're like, oh, I really love swimming, so I'm just going to swim, and out goes a shoulder. Or I love running, it's your favorite thing, so you're going to run, and out goes your knee or your ankle or your hip or your back, or it's all connected. So maybe a combination of those. One thing that I think is really important to think about is whatever it is that you love, if you want to preserve the movement of the exercise that you love, be doing other things. So if you love swimming, please make sure that you're also strengthening the back of the shoulders and the back muscles and the chest muscles, everything that supports the shoulder area. If you love running, you must be doing inner thigh and outer thigh exercises, because you need to support the muscles on the sides of the thighs instead of just the ones in the front. So yeah, taking the balanced approach. I mean, that's anyone who takes my classes, whether they're online or in person, they know it's gonna be a full body workout, and then I might say, but today we're gonna focus a little bit more on butt, or today we're gonna focus a little bit more on abs, or a little bit more on shoulders, but it's always gonna be all the muscles.
This is really great information, and it answers my question about how exercise patterns need to change as we are going through this menopause transition. And this could be in your 40s, right, as you're going through this transition. And so you're saying it's really important, because if you are overusing one muscle because you are active and you do like to run or swim, and having that balance, because I don't know, I meet a runner, it's like that's all they do is they run, and they don't think about going to the gym and exercising certain muscles unless they're going to run the treadmill. But it makes perfect sense to try to preserve your joints. And that's prevention is always much better than, than the cure. So that answers that question too. So as we're aging and we want to stay fit, we want to stay active, we want to keep our muscle mass. And so when we're talking a lot about the woman who's in her 40s and 50s, but how does it change, or do you think it's going to change once we reach our 60s and 70s and 80s? And how do you think our workouts will look like then?
Well, it is going to change, because if you are somebody who's active, if you're active enough, chances are you don't live in a vacuum, so you are going to get an injury somewhere. So, for example, this wrist injury was from I was boxing and I had sweat on my wrist. When I turned a hook, my wrist bent over and I tore a little ligament there. Didn't take care of it for a while because it didn't hurt that much. It was a weird place. So it didn't bother me enough to need surgery. But what happened was I compensated with other movements. I love doing push-ups, and I was making a slight compensatory movement. You don't even realize you're doing it. And it's just so subtle. And so I was very subtly changing something on my left arm to accommodate that little pinch I had in my wrist. And it made me get a tear in my elbow, which then made me get a tear in my shoulder, because it's all connected. I didn't even realize it was happening. 10 years later, the doctor's like, hey, you need wrist surgery. And I said, no, my elbow hurts. Not, my wrist doesn't hurt that much. He's like, no, the wrist is causing the elbow. And he said, I'm not touching your elbow until we take care of the wrist. So what's going to happen is that you're going to get an injury and it's going to affect something else. So for example, somebody might have had pain in their right knee, and then they don't really take care of it. And next thing you know, you have pain on the left side of your hip or your back. And that's called the sling effect. So something happens on the leg on the right side, and then it goes up or down a joint, and that's called the sling effect. So it might affect, if you have a pain in your right knee, it might affect your left ankle or your left hip, like that goes in this crisscross thing, because we make compensatory movements. So things are going to happen, and it's okay. It's okay. That's why I say you have to go to physical therapy, not a chiropractor. You do need to go to physical therapy, and they will see, oh, you have this imbalance because your right knee hurts. You've been doing this funky thing with your left foot or this funky thing with your left hip to compensate. And so let's correct that and let's balance it out. So I think people don't do enough balancing out. And then you might be born, like if you're born with hip dysplasia, mine was worse on the right side. So I had a totally crooked leg. And so I knew for 15, maybe 13 years that I was going to need that hip surgery, because I always saw that my right leg was a little bit crooked. And then the doctor told me why. And I'm like, oh, and he's like, you're going to need surgery. So what did I do? For years before the surgery, I worked my butt and my hip on the right side so much. And what happened was, if you do know that you're going to be needing a surgery, you strengthen that area as much as you can. Just be obsessive about it. And I was able to put the surgery off years longer than the doctor thought I was going to be able to. And then, because I was doing prehab, I kept doing all the exercises I knew I was going to need to do after the surgery. So talk to a physical therapist, or talk to your doctor, or look it up on a physical therapy. There's some YouTube channels or whatever. Or talk to a trainer. If you're getting whatever surgery it is, hip, shoulder, back, elbow, see what the routine is that you're going to have to do for rehab. Do that before the surgery. That's called prehab. And my hip was healed in 10 sessions. I went to 10 physical therapy sessions after my surgery, and the doctor was like, bye, you're done.
Amazing. So what you mentioned about the compensation that we have when we have injuries, you described me to a T, because in my 20s, I had a right ACL tear from skiing injury. And I think over the last 30 years, then it affected the left hip. And it's exactly what happened to me. And then I'm 54, having my second hip surgery in a couple of weeks. You were probably 54 when you had your hip surgery.
Yeah, I was.
So we had very parallel lives. And
that's how we became friends.
Yes. And so I think, yeah. And when I think about it, 30 years, I mean, I didn't notice. I mean, like you maybe seemed like you've noticed. No one ever told me I was imbalanced. Nobody ever, I've always focused on building the muscles around my knee. That's strong. Okay. And I could do everything, all the side to side movement, all the tennis, all the racquetball, everything without an ACL, because I never did the surgery. And sometimes I think, oh, maybe I should have done the surgery, because my whole life has been my knee, make sure my knee is strong, make sure my knee is strong. Never thought about the hip. And then, but it's exactly like you said, some of these things start with injuries. You think they're healed, or you think you're walking normal, but it's such a microscopic movement. But over time, it can degrade. And then, of course, then you wind up having surgeries earlier than you expected.
I want to bring up 2 quick points, if I might. Number one, the most common pain that women our ages have, because we were very active, we got it in the joints that we use a lot for activity. But most people are overweight, and then they also sit more because they're overweight, so it's less comfortable to move. So the most common injury to have is a back problem, especially at our ages. But even younger, mine started much younger. Like I said, my doctor, thank God, told me at 35 that there was going to be a problem, so I was always new. But to talk about how things move up and down, when people don't realize that if they have tight hamstrings, if they have weak glutes, which most women do, and people who are overweight also have weak glutes because they don't get up and move the butt muscles enough, you will have pain in your back from weak glutes and tight hamstrings because the glutes don't work enough and the hamstrings, the back of the thighs, overwork. So, underwork. So the spine muscles, the muscles up and down the spine, they take over for the weak muscles. And so what happens is if your butt muscles are weak and your hamstrings are tight, or one or the other, your back muscles, because your spine is very bendy, it will compensate for tight hamstrings. It will compensate for weak glutes by doing the work that your butt's supposed to do, or or letting the hamstrings move through the range of motion that they should be able to do. So at least by doing stretching, taking efforts to lose weight are going to be really helpful, because the lower back is the biggest problem. And I always tell people that I work with and that are in my classes, they're like, if my back hurts, why are you working my butt? Like, shouldn't we be doing ab exercises and back exercises? And I'm like, nope, we're doing butt exercises first, because when your butt muscles are weak, your back overcompensates for weak butt muscles. And then your butt, of course, it's all connected, is connected to your hamstrings. And then you might have tight hamstrings or weak hamstrings as well, especially for people who sit a lot. So just wanted to throw that one out there. And then just one quick little interesting nugget. I had this client for years. He's like in his 70s now, super fit guy, was a semi-pro baseball player. He used to take my class, and we used to use a step bench to march up and down. It's a very functional movement. Functional is a type of exercise that means this mimics movements in your day-to-day life. So functional fitness, I'm a certified functional strength coach, meaning you perform exercises that mimic a function of day-to-day life. So I'm big on using some kind of step bench, for example. And so we were doing step ups, and he's like, my back really hurts. And he goes to a doctor, and the doctor's like, oh yeah, we're gonna have to do surgery. And then he says, all right, let me get a second opinion. He goes to the next doctor, and the doctor says, yeah, we're just gonna have to do back surgery, because when you're a hammer, everything's a nail. And I said, Rob, do me a favor. Go to one more doctor and have them watch you walk on a treadmill, or walk up and down stairs. I didn't know that he had had an ankle surgery from a bike accident. He did have an ankle surgery. So he goes to the third doctor, and the doctor's like, okay, let me see you walk up and down stairs. And he goes, you don't have a back problem, you have an ankle problem. Did you ever finish your physical therapy for your ankle? He said, no. He says, your ankle problem is causing you don't need spine surgery. That's how important this is, or how important it is to have somebody watch your biomechanics. Because this guy was going to go under the knife, he was going to get a back surgery, and the problem was never going to go away because he needed to regain flexibility in his ankle.
Incredible. Okay,
So I saved him from surgery.
a biomechanic person to evaluate us and get to some of these root causes. And maybe I could have avoided this surgery if I knew that I had to really focus on my knee or something, even though I was always about my knee, but maybe there was something you could have done, right? Who knows?
Well, don't beat yourself up. I can't stress enough how just having somebody watch your biomechanics, have an x-ray, have someone look at it, and then just have a plan. Just like Pilates, and this is my Pilates machine over here, and then I do a lot of Pilates on the floor. I can't stress enough, and I do standing Pilates. I can't stress enough how well that helps balance things out. Speaking of the word balance, we talked about this before we hit record. Also, make sure that you are able to balance as you age. We know this, we've talked about this before. The statistic is if you slip and fall after the age of 65 and you break your hip or your femur bone, you have a 30 to 50% chance of being unalive. We can't say the other word, of being unalive in 1 year.
Yeah, it's a very high statistic. And there's many reasons why that happens. And sometimes it's an infection in the hospital. Sometimes you just can't get back to your mobile life, and you get a little depressed. You don't go out with your friends. And just going through this whole osteoarthritis journey I felt it. And I'm sure you felt it too. When you can't go out and play with your friends,
yeah,
you go, this is not a life. And I guess maybe you and I are just more, not accepting of that and say, okay, let's just go do something about it. But if you're not, I can see how people can spiral into depression and just say, I'd rather be dead rather than this chronic pain or this horrible life. And again, just get the balance. Get you work on your balance, your strength, your mobility, agility is like the mantra I keep speaking, and I know you do too. And it takes, you got to take time for that. And I think that's how definitely we should be evolving towards as we're aging, is just to incorporate more and more of that as much as we can. So the other thing you mentioned too is the glute exercises and the prehab. I'm just like you, spot on. And I think it's just really important that my surgeon now is like, when he cut me open on the one leg, he's like, I have never had such a hard time cutting through somebody's glute as I have you, because I had the lateral approach, not the anterior. He was
Oh,
like,
right.
I had such a hard time like fitting it in. I'm like, sorry, but I should. But he goes, but it's good because it's going to help you with your recovery. And so now I just saw him a couple days ago, and he's like, now your next surgery's coming up. Your job, the only job you have right now, is to get those glutes strong. And he goes, just don't worry about me. I'll get it in.
Yeah.
But that helps with the recovery. And it's,
And that's why, like, so it's so gentle. I'm just such a big fan of glute exercises. People don't realize they're so gentle. I mean, they might burn, they might be hard to do. There's ones that I have all these bands sitting right over there. I put the booty bands on, and we do inner and outer thigh and exercises with outer thigh and hips with the band. At a gym, I'll probably put an ankle cuff on, and you can use cables. I mean, they're not intense exercises. You can just step up and step down on the step bench. There's so many glute exercises, and once women start to see their butt muscles start to take shape and it repositions the cellulite and your butt starts to look better, people love them. That's why when you go onto Instagram or TikTok or YouTube, you see so many butt workouts. It's like the most popular thing, which is great because they're gentle, they don't hurt the knees, they don't hurt the back, done properly, of course, and they start to make your butt look better, and the cellulite moves, and so it's not as noticeable. So I can't stress enough. And even just if you want to do them at home on the floor, just Pilates butt exercises, they're a burner and you need almost nothing. Maybe an ankle weight, a band, a
yeah.
ball. That's it.
So you mentioned, so I feel that too often people who are getting surgeries just go, ah, screw it. I'm going to get the surgery anyways. I'll have a new hip, knee, whatever. And they don't do these exercises. And I don't think you realize how hard recovery is without. I don't know what it is. I mean, they say, because I have my own experience, but what other prehab tips do you have for anyone getting any kind of a surgery, joint surgery?
Well, what people have to remember is that at our ages, we have sarcopenia starts at like 30 something, and that is age-related muscle loss. So as we're getting older, we're losing muscle faster and faster, especially after 50. And once you hit menopause, the loss of estrogen and the loss of testosterone causes us to lose muscle much quicker and makes it harder to build muscle. So the testosterone that we may be lacking, I think you and I both take testosterone, I do, helps you build the muscle faster. It also helps you heal. One reason why I heal so quickly from my low back surgery, I mean, I was walking 3 miles 2 days after the surgery, 9 miles within the week after the surgery, and my OBGYN was like, yeah, that's because of the testosterone. I'm like, yes, I told you. That's why I wanted to go on testosterone before my surgery. That was my game plan. And so I went on testosterone before that last surgery, knowing that muscle was going to be dropping off my body faster and faster from immobility. So I don't think women realize how quickly we lose muscle and how much harder it is to build it. So be doing your prehab, do everything you can to build muscle. You're going to hear a lot of people on the social medias saying, ladies, do more weightlifting, do less cardio. I have a little bit of an issue with this because cardio is also important, but we don't want to overdo cardio. So again, that balance of cross training is really key. If you do full body workouts, if you do like circuit training or some kind of, you can do what I call MITs. You've heard of high intensity intervals. You can do medium, moderate intensity intervals.
I
And
think most people are doing moderate intensity intervals. Whenever I go to a class, I go around as a nomad. I go to a lot of, well, I used to get a lot of classes, and I'm like, this
yeah.
is not, everybody's got a different version of hit, but I don't think it's the true hit. Everybody's doing a bit more mitt, which is not
Yes.
bad. I don't want to say it's bad.
No.
It's just that there are different grades, right? And
It's Yeah, the point is you're getting strength training and cardio at the same time. So if your heart rate's going up, I wear a little heart rate monitor. If your heart rate's going up and you're able to sustain it for a while, you're getting cardiovascular benefits. So basically, weight training or resistance training done vigorously will also give you cardio. So that's why I was saying earlier, I don't think it's a great idea to do the typical male bodybuilder workouts, because we're women and we are not small men. So we shouldn't be doing the same lifting workouts unless you're competing for a bodybuilding competition. I don't think we should be doing those type of workouts. I think we do need to be incorporating cardio, because as we get older, the lack of estrogen and the drop in testosterone makes us not quite as strong. Testosterone helps us build muscle. Estrogen helps protect from muscle loss. As those are dropping, even if we're taking HRT, our doctors aren't giving us superhero doses. They're giving us normal doses. So we're only maybe replacing what we had at, I don't even know what age, but maybe in our early 40s or late 30s. So they're not giving us superhero doses. So we still need to make sure that we're doing some strength training. Because estrogen has a cardioprotective effect on our hearts. As those numbers are lower, we also need to be doing cardio. So it's just, I just can't stress enough, like, you don't pick one or the other. You should find a way to make sure that you're mixing both in. And as far as the testosterone goes, if you're not taking testosterone exogenously, then it's super important that you talk to your doctor or someone who's an expert in nutrition. I'm also a nutritionist, but looking at some of the supplements that can also help build a little bit of testosterone, taking things like ashwagandha for building some testosterone. DIM helps prevent some estrogen loss. Fenugreek maybe has a little bit of effect on testosterone, but if you don't want to take it exogenously, then at least be looking at the supplements and getting enough sleep. Because if you don't get enough sleep, you're not going to be producing growth hormone. And if you're not producing enough growth hormone, and this is the problem with menopause, not only are we losing muscle faster than we did when we were younger, that we're also not sleeping as well, because menopause. And when we're not sleeping as well, we don't produce as much growth hormone.
Yeah,
And
there's so much.
yeah.
It's never one thing. And I think you've pointed out some really good things. That's why pre-surgery, or if you're looking to build muscle as prevention, you mentioned get your exercise in, make sure you get good sleep and take your testosterone or whatever hormones that work for you. And then the nutrition piece, which I'm sure you could talk a lot about too, and you can't build muscle if you don't feed it, right? So you got to feed it enough protein as well. So all of these things are important.
Very important. So every time I work with a woman on their nutrition, when I look at their food logs or what they're eating, they are shocked at how they're not eating enough protein to build muscle. There's a certain amount of protein that'll help prevent muscle loss. And then there's a certain amount of protein that you need. There's a threshold you need to meet to also make sure that you are also able to build protein. Carbohydrates don't count. Fat doesn't count. You can't make muscle out of carbohydrate. You can't make muscle out of fat. You can only make muscle out of protein. And people are just in shock when they see that they're not quite getting enough. So the other thing that I do before a surgery is making sure that I'm getting plenty of protein. And then after the surgery, eating even more protein. A good doctor if you have a doctor that actually was an athlete, they will actually remind you, make sure you get extra protein right after the surgery.
Yeah, you got to build and repair, right?
Yeah, exactly. It helps you repair. So the testosterone helps you heal faster from a surgery, and then the protein also helps you heal faster.
One
and if you
hack that
don't get enough,
What?
sorry. If you don't get enough protein, you're losing muscle. Even if you're exercising, you're still losing muscle, even if you're exercising.
Thank you for that point. Absolutely. We can't do one or the other and expect, results. But one of my hacks for post-surgery, because I don't know if you were like this, but I just didn't feel like eating a whole lot those first few days. I was like, oh God, I know I need to eat, but how am I going to do this? So I took essential amino acids, and I was eating as much as I could, but my goal was pretty high for how much protein I need to eat. And I was like, oof. So essential amino acids was a fabulous hack because I knew I was getting all the essential amino acids that I needed to help build and repair until I really got enough of an appetite to get there. But I continued with the essential amino acids. It's like I still do, and I have already for a long time, but that's been a great hack for the muscle, as well as plenty of other supplements I was taking. But that was I think it's a real key one.
I might add that I am a little bit more, actually, I should say, I am a much more of a proponent of just having a full profile whey protein powder. Whey protein powder is the most bioavailable, meaning you're drinking it and it is being absorbed by your body like instantaneously, faster than any other protein. And it contains all of the essential amino acids, and the primary essential amino acid that's responsible for actually muscle protein synthesis is called leucine, Leucine. That'll be one of your essential amino acids. You don't have enough leucine, you can't just spark muscle protein synthesis. That's the process of muscle building. But when you have whey protein, you're also going to get calcium, and you're going to get all of the other 20 essential amino acids.
I have to share this.
All the 20 amino acids, sorry, plus the essential amino acids.
Yeah. So, I mean, I wouldn't say don't eat food, or you got to eat your food, but I did a really great episode with Angela Keeley, who was all about essential amino acids. And I quizzed him. I was like, what's better, chicken or fish or dairy or a supplement or whatever for getting our essential amino acids? So he said, across the board, food. Like, we need food. That's for sure. That's always the best source. But not everybody can break down the essential amino acids because as we age, we lose this ability. And he said that out of all the food groups, dairy was the highest in terms of getting all the essential amino acids, more than chicken, let's say. So that was really surprising. And then he said that, but beyond that, even the whey protein, sometimes people can't digest it because of the dairy or because it still needs to be broken down. The way he explained it was just kind of the highway, the fast track to getting straight into your bloodstream was the essential amino acids, because they're just literally always broken down. And of course, work on your gut, work on the healing. Everybody's a bit different. So I thought that was a really interesting, and he broke down BCAAs versus EAAs. It was such a great podcast. But that to me, I was like, okay, well, and it was like, get the whey protein or get the chicken. But if you really are struggling because you're not digesting these things, essential amino acids is pretty good. So I'm
exactly, because protein, when you eat fish, or my favorite protein is seafood, but if you eat fish or eggs or chicken or beef, whatever, we have something called anabolic resistance as we get older. So the hydrochloric acid in our stomach doesn't break the food down as well as it did when we were younger. It's just our acid in our stomach is weaker, and that's why we don't absorb it as much. So as we get older, after the age of 60 or 65, we actually need more protein, which is crazy because we feel like eating less, but we actually need more as we get older because of the anabolic resistance. And that's just a fancy term for we don't build muscle so easily. And like I just said, because testosterone, estrogen.
So a lot of, just again, this is so many reasons why one person versus another too is struggling. But I want to go back to your surgeries and before you choose one, your back, your hip, whichever one you want, what kind of therapies did you try before the surgery? And because you and I were probably delaying as much as possible any kind of surgery. So I spent myself tens of thousands of dollars on things. I did a whole podcast on what I thought brought me relief, but ultimately I had to get a surgery. But what therapies worked for you?
One is seafood. For people who don't like fish, you really need to be taking the essential fatty acids, the omega-3s. So those are helpful for your heart health and helpful for joint health. Some people like to use glucosamine and MSM and chondroitin. So I have that liquid stuff. The research is very iffy. It's like half the people say they feel something, half the people say they don't. Same thing with the omega-3s. Half the people say they do, half the people say they don't. But because we have this overweight and obesity epidemic, 75% of the US population now is overweight or obese, 75%. So in the 30 plus years that I've been in this industry, it used to be like 40% had obesity, then it went to 50, then 60. I mean, watching the number has been nuts. Then people say, oh, well, great, we have these GLP-1s, we have semaglutide, and we have Mounjaro and Wegovy to help me lose weight. Well, guess what? When you lose weight, you're also losing muscle. There is no scenario, unless you're a professional bodybuilder, and even it happens with them too, it is under no scenario can you be losing a meaningful amount of weight without losing muscle. You lose fat, you lose muscle. You cannot just lose fat unless you are on an extremely high protein. Even bodybuilders, you've heard of bulking and cutting. They bulk up because they know when they cut, they're going to be losing some muscle as well. So they put on extra fat and extra muscle, knowing that then they're going to hit their sweet spot. Same thing happens with women. So as we're losing weight, hopefully fat, we mostly want to lose fat. We want to mitigate as much muscle loss as possible. So the other thing is, like we just talked about, is making sure you're getting enough protein, and then make sure you're getting enough sleep, because you're not going to be able to repair the tissue as well. You're not going to be able to build the tissue as well without growth hormone, which is primarily released in our early stages of sleep. So I know this is not like some supplement, but your sleep and your protein are going to play a huge role in your prehab to offset how long it's going to be before you need surgery. Also, knowing which joint you have injured or what part of your body you've injured, and making sure that you're working the muscles around it. And then other supplements, you can try things like PRP. Some people have luck with PRP, some people don't. It really depends on the person administering it. There's also, for people with arthritis, there's hyaluronic acid, so Monovisc or Synvisc, which is the same stuff we put on our skin, the hyaluronic acid, they inject it into the joint. So that can help offset a surgery for arthritis.
Did you try any of these things? I mean, I know you did the exercises, but what about PRP and hyaluronic acid?
I did not do the PRP or hyaluronic acid yet. My boyfriend did, because his problem was in his knee, and he had some good results. Perfect, but it got him through a tough spot. He can't run anymore, and running was what he loved to do. So he just had to, which brings me back, I just want to circle back on one more thing that you said, which is runners and all they do is run, or swimmers and all they do is swim, and then they get very depressed. So if you find out that you love one particular exercise, and then like your life is over if you can't do that, let me tell you how many times I have had an injury where the doctor's like, well, that's done, you can't do that anymore, and that's done, you can't do that anymore. Like all through these 20 years, one doctor's like, well, now you have a neck injury, so you can't rock climb anymore, you can't box anymore, you can't do downhill mountain bike riding. I'm like, okay, well, those are the 3 sports I was doing. What should I do? He's like, try rowing. I'm like, great. So now I started rowing. Then my low back surgeon, he's like, well, you can't run anymore. I'm like, yeah, I already knew that. And he's like, and you can't deadlift heavy anymore. And you can't squat heavy anymore. So I'm like, all right. So you always have to keep thinking, like one thing that really ages us is having that fixed mindset. Like, this is what I do. This is who I am. I'm a runner. If I can't run, I might as well just kick the bucket. There are so many other things that you will love to do. Your body loves movement in various different ways. Sometimes you just have a bad trainer or a bad class, or you're in a bad mood, or there's bad music. So many times people go into, let's say, a spinning class, which is great for your knees and great for you if you have a back problem or an arm injury. But there was music that they didn't like. It was too much techno, or it was too much rock and roll. And they're like, I didn't like, or the saddle hurt because the instructor didn't adjust the seat height. Like you can see, I was one of the world's first spinning instructors. Like it is in my blood. I taught spinning like through 30 something years. But it's really gentle on the body, and it's an incredible way to get a great workout. If something gets taken away from you, find other activities that you can enjoy, and don't go by the first experience, because sometimes riding a bike makes your butt sore, sometimes swimming makes your shoulder sore, but you have to experiment. And if you want to age gracefully, you need to have a growth mindset. So how did this affect me? I know is one of the questions you're going to ask, and it made me a better trainer, because I was like, all right, so if I have a neck injury or a spine injury, here's the entire backup plan for that. Oh, you have a hip injury, here's the entire backup plan for that. Wrist injury, lots of women get wrist arthritis, and obviously I have a limited range of motion in this. Here's the backup plan, here's how we work around. There's always a workaround, and your body needs to find movement. And yes, there are many times I've come home from the doctor and I've cried because I can't do this exercise anymore and I can't do that exercise anymore. Well, there's a lot of other exercises out there, and I will find something else that I can do.
Oh, I like this growth mindset. Well said. Well said.
Thank you.
Then what about, let's kind of go back to just before the surgery, because it sounds like you've kind of gone through this and now on the other side with such positivity, and I want to help women through this as well. So did you ever, I mean, you at quite a young age, you had to get a surgery, so even much younger than, like, even when we're saying our 50s and getting a hip surgery, you had stuff that was going on much earlier. So did you ever struggle with this stigma of getting these types of surgeries at a younger age?
Yeah, I mean, because I'm a professional, I was like, I'm going to overcome this and show people that, hey, I can overcome this injury. And then, of course, you find other people who have had the same injury as well, maybe not the exact same age, but not too far of a distance in age. And when you feel like you're not alone, that helps your own personal stigma. And then there are people who say, wow, you've needed so many surgeries. Are you just a klutz, or do you just have bad form? And I was like, nope, some of it was my own, I am an endorphin junkie, so I just love I had a lot of depression as a kid, and I had a lot of just family strife growing up. I didn't have a very easy family life, and exercise was my escape. And so I did self-medicate ADHD by doing some extra exercise, which, like I said, exacerbated the problem from overtraining, but it was my escape from just tragedies and traumas. And so there is that. And so would I say that it was a stigma? For me, it was like, wow, this is a trainer that knows how to deal with spine injuries. This is a fitness instructor who knows how to deal with hip replacements, hip injuries, back injuries, knee injuries, wrist injuries. So it actually helped me be a better trainer and a more compassionate trainer and understand what people are feeling. So it was not a stigma for me, but I can understand how athletes, there are a lot of well-known athletes, like Laird Hamilton had to have his hip replaced, and David Goggins had to have, he did one hip or a knee. So these are like famous athlete coaches, and you rise above, and you just show the world, like, yeah, I had this injury and here's how I overcame it. And then if you can help other people, one thing that I like to say is sometimes your biggest struggle is going to be the motivation or inspiration for someone else.
I hope so. That's definitely what I'm trying to do now. There's somebody who connected me to follow Jenny Garth. She's an actress from Beverly Hills 90210. And I told you a little bit about her. And she had her second hip surgery, and she made a podcast about it after her recovery, after the fact of getting both of them done. And she didn't tell anyone until it was over. And she said she was afraid because she was struggling with this sort of quote unquote old person's disease. And she felt that she had to hide it. And it's not glamorous. It's not sexy. And of course, you feel alone, especially if you're younger. And so this is what as I was first told to get herb surgery, I was laughing. I was like, yeah, obviously you don't know me. That's beyond like that. I couldn't even imagine. And I didn't know athletes who had this, just didn't make that association until you start to find people like you online, and you go, hey, you know what? There is a whole other group of people out there who are struggling with this. And so I'm wondering what you think. Do you think that more women will start sharing their stories and just help to inspire other women of a younger age?
Well, I think it's nothing to be ashamed of. I mean, you asked me earlier, why do people have more surgeries now? Well, one reason why younger people are having more surgeries is, like I was talking about, the obesity epidemic. Your joints are going to wear away faster if you're overweight. So I think that I should have said this earlier, buttoned up that comment, that when you're overweight, you're going to have more joint issues. And people, I have clients that are in their 20s who are obese, or clinically, meaning their BMIs are over 30.
Yeah. And then when you search osteoarthritis, like for example, online, and you're trying to look for solutions, the answer is lose weight.
Yes.
And so when I look at that, I'm going, well, I can't lose any more weight. Like,
Right.
fly away.
Well, I'm saying for people who are, so if you're
Yeah.
younger and you're having joint issues, weight loss is going to be a big thing. And the other reason why they're having more surgeries is when you're overweight and your joints are wearing away faster, so we're getting earlier arthritis. It's because when you're overweight, you don't feel like exercising. Your body doesn't feel good moving. So it starts with nutrition. We lose much more body fat from nutrition than we do from exercise. You've heard of the 80-20 rule. 80% of the fat loss is from your nutrition, 20% is from exercise. So if you don't feel great exercising, make 20% of your plan walking, doing Pilates is gentle for everyone, or finding something like spinning or something that's gentle on the joints, walking uphill on a treadmill where the ground is soft. It is harder to walk outside because the pavement is more jarring. Treadmill is a bouncier surface, so you will have less joint pain. If you're going to be a walker, walk on a treadmill to get started. But the weight loss is going to be key to help protecting your joints. And that's one of the reasons why people are getting surgeries younger and younger, as our joints are wearing away faster and faster from that. And then also just not having enough education about nutrition. I don't think people eat enough seafood, and which is very protective of the joints. And I don't think the quality, we can go into a whole other podcast about the quality of our food. Quality of our food isn't as good. We have too much fast food, too much processed food. People aren't doing enough cooking at home. So one thing I teach my people to do is do meal prep with me Sundays on TikTok, and let's start just having plenty of vegetables. But I don't think people are eating enough phytonutrients, which keeps our joints healthy. I don't think people are taking their weight seriously because they think, oh, I can just take a GLP-1, I can just take Govi or Monjuro and lose weight that way. And that's not really the solution. That's the solution for helping you lose weight so you can move more. Like I have clients that are obese, they're on these weight loss drugs, and I'm like, excellent, let's use them so that we can walk farther and do more squats, and now you will feel lighter on your feet. And it's been very helpful to use that weight loss to do more exercise. And then, did I answer your question about stigma? I just think that
Yeah, I think it's going to happen. I think more and more people, and I think it takes people like us, and that's why I invited you to this podcast to talk about it, because we're not alone. And if anyone's listening to this, it's probably because they starting to have some joint pain, or they're thinking about they may need surgery. And I just want to reassure them that it's okay, right? This is just happens. It's nothing you did wrong or anything like that. And as you can hear from both of us, that it's okay. You have, the point is it's done. You have to move on with your life, and your positive mindset that you have, and that I'm going to overcome this, and I'm just going to shift gears, and I have a growth mindset. I think this is some of the most valuable information that we can have today. And then you'll be fine. I mean, look at you, and you had all these surgeries, and you're still fit, and you're still jumping around. You're still doing everything that you enjoy doing. You're always finding new things. So I appreciate.
Oh no, my doctor said I can't jump anymore.
Jumping. Well, but you're still you're doing a lot.
Yeah.
You're moving around. So
It's like you have to be a little bit stubborn. You have to be like, okay, so I can't do this, so what am I going to do? There's a myriad of things. It's not over until it's over, to use a trite expression. But if you have that mindset of like, what can I do instead? What else can I do? There are so many things out there. And what keeps us young is learning something new. Right? So if you've had your hip replaced, you're like, oh, I feel like an old person, my back, my hip. I mean, in 1 year, I had a wrist surgery and a back surgery. And then the year before that, I had the hip surgery. And you just think, all right, well, what else can I do? What's new to learn? And what makes me feel positive is the fact that I'm going to get some attachments from my reformer. I'm going to learn a new system or a new methodology. So as long as you're open to learning something new, it's going to keep you young, and your body's going to thank you as well.
well said. I'm going to have to let you go, but I want everyone to know that they can find you on Instagram, TikTok, and Facebook at Jill Brown Fitness. I'll have links to your gut guide and intermittent fasting guide, and they can book a call with you, and I'll have links to all of that. But you've got this Healthy Habit Mastery program coming up. What's that all about?
So starting January 27th, I take a small group of people. I might have to divide them up into 2 groups, but I take a small group of people and I privately coach them, and we work on changing habits. Whatever habit that you need to ingrain, whether it's being more consistent with exercise, more consistent with protein, more consistent with sleep, any combination of those, whatever's going to bring you to better health, because I am a master health coach, a nutrition coach, and a fitness coach, and a certified functional strength coach as well. Whatever habit it is that you have to build, that's what I help you drill down on. And it might be a combination of all of these just to live a healthier lifestyle. So some people might come to me, they're pre-diabetic or they're already diabetic, and their doctor's like, you got to do something about this. We got to, start getting you off sugar and lowering your carbs. Someone else might just have had a surgery and say, I've got to start, being more active. How can I stay consistent? Because when we have healthy habits, then it's easy for us to maintain those through life. The problem is people do, I'm going to do this 6-week Get Fit program, or the 75-day hard, or this 30-day challenge, or this 20-day challenge. And then that challenge is over, the 21-day challenge, the whatever challenge, but they haven't ingrained the habits. And so they go right back to where they were before. Mm-hmm. It comes down to building the habit, and that's what's going to last forever, because once you have a habit, it's harder to break a habit. But if you haven't ingrained the habit and you try to do a 30-day challenge, a 2-month challenge, or what have you, you fall right back. I mean, how many people do you know have done a 21-day challenge, and what did it do? Nothing. They're right back to where they were. Oh, I did no sugar for 2 weeks, and now they're back to sugar. Or I've done this 30-day plank challenge, and now they don't do planks anymore. You have to ingrain the habit. And as a master health coach, I do help people ingrain the habits.
Fabulous. Well, this podcast is dropping in February. So do you have a challenge coming up?
Oh, yeah. Well, I do them every several months. I'm sorry. I thought this one was starting in January. So then 2 months later, there'll be another one. Okay. So then the next one will be in March.
Oh, perfect. Okay. So it's coming up.
Like they're every 2.5 months.
Excellent. So I will have a link to that mastery program. If anybody wants to sign up, just go to the show notes. Thank you so much, Jill, for your time and your inspiration and positivity. I absolutely love it. So hopefully we'll have you on again.
Absolutely, Zora. Thank you.